Hi everyone, and welcome to Nairita's talk. Today I'm visiting Valiant Clinic at Dr. Shadan Naji to demonstrate her signature treatment in face contouring. So, what are we doing today, doctor?
Okay, now today we have our beautiful patient with us, Zaina. We are going to do a filler treatment, but this filler is not for volumizing, it's mainly for lifting. And this is one concept that nowadays we talk about with our patients, that filler, it's not as the word tells. It's a treatment that we use in order to lift up the whole face and also to create more contouring and more definition in the whole face. So it's not necessary, if you are doing filler, to look more puffy or to look more obese or to look bigger. No, it's the opposite. We are giving you specific area of support.
So the lifting point.
Exactly. That will make you look slimmer but more lifted. Okay. And this is something that is really important. A lot of patients, they are still afraid, no, I don't want to do fillers because the filler will
plumps the area.
It will make me look bigger, it will make me look more as if I gained more weight. Here we are doing the opposite. We are using specific points in order to give us a support, and this is after studying the science of aging, how we age. We now know that there are specific areas that lose support over time.
So the points.
Exactly.
Can you show us where are the points?
If we look at the face, we have an oval face, and this is something that we really like. But we can see, if we start from the upper third of the face, we see that there is a little bit of deflation in this area. A lot of patients, they don't recognize that there is a problem in this area, but this area gives you more sagginess in the eyelid, and also it affects the whole sagginess that comes on the face. So giving a little bit of support in this area, in the templar area, will give us not only support for the whole face and the eyebrow, but it will make you look younger, fresher. Okay, so this is one treatment that we are going to do, which is the temple area. Now, the cheek is the main area that we need to have a very nice projection in order to have a fresh, nice, beautiful, attractive look. If we can see, we have a good amount of fat in this area. Can you smile, please? You see this? I don't want to give her a bigger cheeks, not at all, but I want her relaxed. I want to reposition the tissues, so I want to give her more projected area in the lateral cheeks that will make her look more supported. And when we support this area, that will help us on the nasolabial fold area, and also it will help us on the sad lines, or what we call the marionette lines. And the last area, we have a strong bone projection on the jawline area. But what we are going to do, we see that there is a little bit of sagginess in this area. We can, with using a very specific amount of filler and a specific type, which is, now we are talking today about Restylane and Restylane Lift, that has the maximum lifting capacity among all fillers available in the market. We are going not to give her a bigger or a wider or a more pronounced jawline. We're going to give her only a little bit of lifting and definition to this area that will help to support the area on the marionette line area. So this is Restylane Lift. This is one of my favorite products that I use. It's different from all other products that are available in the market because this has something that is high G prime. It means, this is in science, it means for us as patients, it can give us a maximum lifting capacity with a very low volumizing effect. That means whenever I want to do more lifting, I can use this product. The combination with this product, this is a define, this is degree number 2. After this, it gives me a little bit of volume, but at the same time, it gives me a very good and maximum support to any area that I'm treating. The second area that we are going to treat is mainly the cheeks. We're going to give her a little bit of support in this area and also a little bit of support in this area. And then we're going to give her more support in this area only for lifting purposes, not to create more volume and not to widen or make the jawline area bigger. Okay, one observation, as we see here, this is usually, it depends on the case, we have a very strong chin. That's why we are not focusing and we are not treating the chin area, because she has a really very nice good projection on the chin. Now we will see, with injecting of a small amount of product, we're going to have really a big difference in the lifting of the face. It will be minimal, okay? Go. It's very important to identify exactly what is the objective of this treatment, whether we are volumizing or doing a lifting approach. The choice of product, in my opinion, is also very important because there are a lot of fillers that will only give you more and more volume, and you should be careful about continuing injecting more and more filler without stopping at certain extent. In that case, you will look more old or more tired because your face will look heavier, not more lifted or not more contour. We have to understand that when we are talking about good products, especially the lifting products like the product we are using, the longevity of this product is around like between 6 and 8 months. So no need to repeat the treatment before that if we have done the full treatment that we require.
So what are we doing now, doctor?
We are just supporting the root of the nasolabial folds. You see the difference between this area and this area. I gave a very small support deep on the bone just to open up the nasolabial folds. I don't need to treat here because now with this nice projection and here,
it will lift it up.
It's much better. Doing filler treatment, it's not about doing something that will change you dramatically. It's some treatment that will support you, make you look younger, less tired, fresher, but at the same time it will not change your face. Trying to support the area underneath the old filler to not have this gap in this area.
The bumpy look.
Yeah. Now we need to give the filler 1 week to settle down and also for the swelling to be gone. That's very important. The filler treatment usually is a mild treatment, so a patient can continue her activities normally. She can put makeup after an hour of the filler treatment. She needs to avoid sun exposure and doing sports for 24 hours and do not sleep on your face for this night only. Okay, other than that, everything is normal. We need to wait for 1 week until the swelling is gone. We will see the final result. Usually we do the re-evaluation after 2 weeks. Definitely she looks much better. She looks more relaxed, more lifted, but she doesn't look totally different. She's not another person. She doesn't look as if she was filled up. This is very important, and this is for me also is a very important concept to tell our patients that when we use filler treatment, it's not necessary that we are volumizing. We are not giving bigger cheeks. We are not giving a wider jawline. Yeah. Here we are giving more.
We're just targeting to the right areas and the right points.
Exactly, and we are reducing the saggy look. We are reducing the tired look. Yes. So the patient looks just fresher.
Lovely.